Good evening, everybody. Thank you so much for coming to our Medicaid forum. It really is very timely because we know that more than ever, everybody is talking about affordability and how difficult it is to live and subsist in Lower Hudson Valley, in New York State, in the United States of America. And we have many partners here tonight who are working so hard to make it easier to manage this very, very difficult time. Before I move on to tonight's business, I just want to give a shout out for another healthcare related program which is coming up at the library. The library and several others, I don't know the others, will be hosting demystifying Medicare workshops as we approach open enrollment. So I just wanted to make sure everybody knows that. We have flyers with the details regarding dates and times at one of the tables outside, and hopefully you will take advantage of all the materials here tonight. As many of you know, it is very unfortunate that the Trump administration and the current majority in Congress have chosen to make it significantly harder for people to obtain and afford the health care they need to survive and that they deserve, because we know that healthcare is in fact a human right. It is our hope that through events like this and future communications that we can help blunt the effects of this legislation that has been passed that is going to make it harder to access healthcare. And just to make clear, it isn't just for Medicaid recipients that it's going to be more difficult. It is going to be more difficult for everybody to access healthcare because unfortunately, our hospitals rely on healthcare to provide services, and if they aren't able to get the money that they usually do from Medicaid, we are going to start to see closures. We are going to feel much longer wait times than we already are experiencing, which I think many of us already know, and it's just going to make it just that much harder to obtain the healthcare that we need. Hi, Nancy. So it is our hope that this event and that future events will help blunt the effects of this legislation. There will absolutely be cost increases and other negative impacts that we're not going to be able to prevent here at the state level, although we are going to do our very, very best. I know that the governor was just speaking today about the SNAP running out, and that we are going to do our very best to come up with a short-term solution to that, because it obviously is going into effect much sooner than we had anticipated, November 2nd. But we're not going to be able to backfill everything that the federal government is taking away. Many of you know that I am a co-sponsor, and I believe that's true, Pete, as well. I know it's true, actually. I don't just believe it, I know it. Of the New York Health Act, which would establish... Yay, I know it is yay. And I was actually on a call today with some other champions of the New York Health Act to talk a little bit about how we can continue to build momentum for that, because we know how important it is to establish a single-payer healthcare system here in New York. It's my understanding that not only would we eliminate the $13 billion in losses to the state, but we would end up having $20 billion in the bank, in the black, if we were to move to the single-payer healthcare system. And that would also allow everybody to have access to dental, vision, mental health, and long-term care, in addition to everything else that our healthcare, when we have it, currently pays for. And it would enable New Yorkers' healthcare costs to considerably go down by replacing all of the various co-pays, deductibles, and premiums that we were paying with a simple progressive tax. I was listening to a show on the radio yesterday about somebody who was from the United Kingdom and had immigrated to the US, and she was saying how she thinks it's so bizarre that people in this country think it's progressive to actually have insurance, have universal health care. That's not progressive. That's not considered progressive anymore. Also, it would save the state money, particularly when we're considering the massive budget hole that we're looking at once the big ugly legislation that was passed in July takes full effect. So I'm going to continue fighting for this legislation. It's New York's best opportunity to replace our current system with something better instead of succumbing to something very, very worse. I'm very grateful for the lineup that we have this evening. My friend and colleague and wonderful partner in the legislature, Senator Pete Harckham, is here. He's going to introduce our panelists or our forum speakers tonight. And I do have somebody translating this, what I just said, more or less in Espanol. Can people, alguien que necesita traducción en español, aquí o no? Si no, I don't think we'll do it.
Well, we do it for the recording.
Oh, we're going to do it for the recording. Okay, we're doing it for the recording. I'm sorry. So Danielle, please come on up. We thank you so much for helping us out this evening. And I'm going to hand over the microphone to you, or whatever you like, whatever is easier for you. Okay, thank you so much.
Okay, buenas tardes. Voy a traducir lo que acaba de comunicarnos la representante Levenberg. Gracias a todos por venir hoy y a todos los aliados que han hecho posible el evento de esta noche. Antes de pasar al tema principal de la noche, me gustaría mencionar brevemente otro programa relacionado con la salud. La Biblioteca de Ossining y varias otras instituciones estarán organizando talleres titulados Desmitificando Medicare, a medida que se acerca el periodo de inscripción abierta. Tenemos folletos con los detalles sobre fechas y horarios en una de las mesas afuera. Es lamentable que la administración Trump y la mayoría actual en el Congreso hayan decidido dificultar significativamente que las personas puedan obtener y pagar la atención médica que necesitan para sobrevivir y prosperar. Esperamos que, a través de eventos como este y de futuras comunicaciones, podamos ayudar a mitigar los efectos de la legislación que se ha aprobado para dificultar el acceso a la atención médica. Queremos que nuestros electores tengan la información necesaria para tomar medidas proactivas que protejan su atención médica. Aún así, habrá aumentos de costos y otros impactos negativos que no podemos evitar a nivel estatal sin realizar cambios muchos más amplios. Muchos de ustedes saben que hoy soy copatrocinadora y gran defensora de la Ley de Salud de Nueva York, New York Health Act, que establecería un sistema de atención médica de pagador único aquí en el estado de Nueva York. Esta ley nos permitirá reducir considerablemente los costos de atención médica para la mayoría de los neoyorquinos, reemplazando los diversos copagos, deducibles y cuotas mensuales que pagamos actualmente por un simple impuesto progresivo. También cubriría servicios de visión, odontología, salud mental y atención a largo plazo, además de los costos incluidos en la mayoría de los planes médicos típicos, llevándonos hacia una atención médica universal e integral en lugar del sistema confuso y costoso que tenemos ahora. Además, ahorraría dinero al Estado, especialmente si consideramos el enorme déficit presupuestario que enfrentaremos una vez que entre plenamente en vigor la legislación perjudicial aprobada en julio. Seguiré luchando por esta legislación. Es la mejor oportunidad de Nueva York para reemplazar nuestro sistema actual por algo mejor, en lugar de resignarnos a algo mucho peor. Gracias.
Thank you so much, Daniela. Good evening, everybody.
Good evening.
Come on now. Good evening. It's not that late yet. I'm Pete Harckham, for those of you who don't know me. My first job tonight is to say some thank yous for the people who put this together. First, my amazing partner in the legislature, Dana Levenberg, and her great staff. And we want to thank my great staff for all the work that they've done putting this together. And Daniela Costantino from Neighbors Lane, thank you. And we want to thank Elizabeth Benjamin, who is going to be our first speaker from Community Service Society. Let's give it up for Elizabeth. And then our next speaker will be Sonia Shaker, Deputy Director from New York State Department of Health. Thank you for being here. And I just want to say a quick word. There is a lot of nasty noise at the federal level about demonizing government workers. We are so blessed in New York State. We have the best workers in New York State. White-collar workers, blue-collar workers, professional workers. We thank you and your team for everything you do. Thank you so much. So Dana said a lot. Bad news and good news. Bad news is federal government cuts to Medicaid, the Central Plan in New York. We're estimating 1.5 million New Yorkers may lose coverage. 1.5 million. That's a stunning number. As a result of the loss of those funds, other funds, another 6 to 8 to 10 billion lost to the healthcare system and hospitals. We expect 300,000 people maybe in healthcare related jobs to lose employment because of this. This is a big deal. So that's the bad news. The good news is we live in New York, where as Dana said, we believe healthcare is a right. It's not something, a privilege for the wealthy. And what's more disturbing and disgusting about all of this is it was done to give a tax cut to the wealthiest Americans. You know, this is not who we are. We don't want our kids to go to bed hungry at night, so we're fighting the SNAP cuts. We're doing what we can there. We were with the governor last week, Dana and I, at Westchester Medical Center, where the governor presented them with $100 million to support them as a distressed hospital. In the budget, we appropriated $2.6 billion to support our distressed hospitals. And the governor very clearly expressed the values that Dana said and that I am saying. We care about each other in New York, and we're going to find a way through this. You know, there will be damage, there will be collateral damage. I can't promise everything's going to be rosy, but we're going to come together and we're going to figure this out. And with the great partners we have, and I haven't thanked all of our amazing vendors yet, who are here outside, and our speakers, that's how we're going to get through this, is through all our partners who are here. You know, the faith-based community, government agencies, NGOs, the nonprofit world, our healthcare system, our community health centers, our hospitals. We're going to come together and we're going to figure this out so New Yorkers will continue to get health care. So with that, I'm thrilled to be here. I'm glad you're all here. Thank you. This is a great turnout. And with that, I'll turn it over to Daniela for a translation, and then we'll hear the first presentation from Elizabeth Benjamin. Thank you so much, Daniela.
Gracias a todos por estar aquí hoy en este importante y oportuno foro y feria de recursos sobre el cuidado de la salud. Es un honor darles la bienvenida mientras nos reunimos para hablar sobre un tema urgente que afecta a miles de residentes en nuestra comunidad, los posibles recortes federales a Medicaid y lo que podrían significar para las personas y familias que dependen de este recurso vital. Como muchos de ustedes saben, Medicaid y programas como el Plan Esencial de Nueva York brindan acceso fundamental a la atención médica, desde visitas rutinarias al médico hasta tratamientos que salvan vidas para personas de bajos ingresos, niños, personas mayores y personas con discapacidades. Pero con los recortes federales propuestos en el horizonte, existe una amenaza muy real de que la atención médica se reduzca, se retrase o incluso se niegue. Los neoyorquinos enfrentan la pérdida de 13,5 mil millones de dólares en fondos anuales de Medicaid. Más de 2 millones de neoyorquinos corren el riesgo de perder su cobertura de Medicaid y del Plan Esencial. Por eso estamos aquí hoy, para mantenernos informados, preparados y conectados. Este foro es más que una conversación sobre los desafíos. Se trata de asegurarnos de que todos conozcan sus opciones, sus derechos y los recursos disponibles para ayudarles. Hablaremos sobre cómo el Plan Esencial encaja en este panorama y escucharemos directamente a diversos expertos sobre cómo podemos enfrentar estos cambios juntos. También les presentaré Presentaremos a organizaciones comunitarias, defensoras de la salud y programas de apoyo que están aquí mismo en nuestros vecindarios, personas y grupos listos para ayudar a que nadie quede desamparado. Así que una vez más, gracias por asistir, por escuchar y por dar este paso para proteger su salud y su futuro. Comencemos. Para aquellos que necesitan copias de la presentación, están en español aquí afuera.
Thank you. Okay, I think this thing works, right?
Yep.
So I'm gonna not be able to turn this off. Well, hopefully I could just put it down. Is it gonna make a horrible noise? No. Okay, great. Hi everyone. It is so nice to be here. I really want to thank Senator Harckham, Assemblymember Levenberg, who I'm just really getting to know for the first time tonight, and Victoria, her staff person, who is so wonderful. And I'm really happy to be here. I work at the Community Service Society of New York, and we basically work to promote economic opportunity for New Yorkers, centering our efforts on, elevating the voices and experiences of low-income communities and communities of color. We're really fortunate to run two, well, actually more than two, but these special consumer health assistance programs. Our flagship one is called Community Health Advocates, and it helps people enroll in, use insurance, resolve medical debt. We have a live answer helpline. We have a network of 24 amazing community-based partners, including Westchester Disabled on the Move, who's hopefully still here, and they have stuff out there, swag out there. And we also, are a lot at all-payer programs. So it's like one-stop shopping. So if you call us, we can get you to the right services, including our partner, sort of one of our second programs that Senator Harckham was so crucial in getting off the ground, which is Community Health. I always get, it's called CHAMP, Community Health Access for Addiction and Mental Health Care Services Program. It's a really great program. We call it CHAMP. We always use the acronym CHAMP, but it is really a great insurance ombuds program that help people, who are desperate to use. A lot of times health insurance doesn't work so well if you need substance use services or mental health services, and that program is there for you. It's the same phone number, 888-614-5400. No wrong door if you call CSS. So that's who we are, and it's great to be here tonight. All right, we're here to talk about there's many names for this bill that was enacted this summer and signed by President Trump. I just call it HR 1. I'm agnostic on, the epithet. So, and it's bad. It's gonna result in premium increases for at least 22 million Americans unless, and that's sort of what this shutdown fight's all about. I think Sonia might be getting into a little of that, so I'm not gonna get too deep into that. It's gonna have increased out-of-pocket costs for everybody because our healthcare system sort of depends on one set of people having coverage. It kind of balloons out to others. So if you push on any place, it's like a Pillsbury Doughboy. If you push on them, it kind of explodes outwards, and that's the big problem. We expect 50 million Americans and legal immigrants in the United States to lose coverage over the next decade. And what we know for sure from the science and from the evidence, and I still believe in medical evidence, is that when people lose coverage, people die. And that's just a sad fact. People get sicker, they go further into debt, and more people will die. And there's a projection of 42,000 Americans will die as a result of this bill annually. So how is this going to affect New York State? Well, as Senator Harckham said, they're projecting 1.7 million New Yorkers will become uninsured. We're going to talk about why that's going to happen and who's getting cut. Premium increases are going to go up. Sonia will talk more about that. The state budget is going to have a hit about $13 billion a year. Providers, there's a huge hits to providers, hospitals. We expect the Hospitals Association and the governor thinking it's about $8 billion in losses for those systems, $300 million in losses for our community health centers. And it really kind of worsens the viability of many hospitals, including 18 rural hospitals that are already threatened and risk closure as is. And we only have a couple hundred hospitals in the state, fewer and fewer and fewer. And then job losses, 34,000 hospital jobs, 29,000 other jobs. So it's bad, like the projections are bad. And I'm sorry I can't be like a good news person today. Already 1,000 people with a special legal immigration status called Deferred Action for Childhood Arrivals. These are children, people who were brought as children in the United States as undocumented, have already lost coverage through the marketplace. And then starting 2026, and then there's sort of a wave of bad news over the next 3 years. And I'm really gonna focus on 2026 and 2027 because those are the things that are happening right now. Right now, what the government shutdown is all about is ACA, these enhanced Affordable Care Act subsidies are due to expire, and if they expire, at least 140,000 more New Yorkers are gonna have to pay more, and a lot more. So somebody who's making just over 400%, a family is just, are you gonna go into some of these numbers? Like, okay, a family that's over 400% of poverty is gonna have to pay like, $60,000 for health insurance for this. It's just mind-boggling numbers, like crazy numbers. But anyway, Sonia will get further into that. 450,000 people on July 1st, 2026 are going to lose, they had free, no deductible health insurance with very low cost sharing. Those folks are going to be cut from the program. We estimate July 1st, 2026, although I think we can talk to our members who are here in this room to kind of delay the implementation of it and talk about ways to mitigate that problem, that next, like 6-8 months from now problem, and I'm going to get to that at the end. And then there's going to be cuts to federal funding for lawful immigrants. And then the next year, more federal funding terminates for kind of wealthier lawfully present immigrants. Then they're going to start this sort of really mean stuff to people who have what we call the Medicaid expansion people. So people that are sort of slightly higher and use Medicaid and may not have children or are not pregnant. And those folks are going to be required to recertify for coverage twice a year. What happens when you require people to recertify? You lose 30% of the population every time. Like it's just boom. Because it's hard, it's bureaucratic, and as great as our marketplace is streamlining things, you just tend to lose people when you make them have to come in, show paperwork, attest to something, and they make the paperwork harder. That's part of the plan. And then the other thing they're gonna do is require people to do work requirements. Okay, so I'm going a little too slow. And then it gets worse and worse. So this is how coverage works. We have 19 million people in New York State compared to the rest of the country. We're going to take 10% of the cuts to the uninsured. The rest of the country gets 7%. So it's worse for New York. They targeted New York, that's for sure. And the 6 members who voted of our congressional delegation, 7. The 7 members of our congressional delegation that voted for this, really shame on them. And one of those members lives just up the road from here, and that's Congressmember Lawler, and we really would love it if people could tell him and explain to him why we don't believe in New York State cutting people off of health care. And so here we're going to expect 1.2 million to lose Medicaid, 140,000 people will either cut or have higher premiums in the marketplace, and 450,000 people to lose essential plan coverage. And this is just talking a little more about those essential plan coverage people, but I feel like Sonia might be doing some more of this. So I think it's just really very, anyways, this just sort of gives you a sense of 1.7 million people in essential plan, and look, 450, now we're going to be down to 1.25 million. And this is just like what the essential plan means to people. This was a client we helped in Sullivan County, just across the river, a little up north. Her name's Alicia. She's 25. She used to avoid going to the doctor because she was worried about medical debt. We signed her up for essential plan. She's incredibly relieved. She could get preventive care. She didn't have to do, just plunk it out for 8 urgent care visits. She's got dental, vision coverage, preventive screening, and she's just so happy. So what can we do? What's next? Well, number 1, reach out to the governor and the legislature. Please, 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 let's figure out a way to mitigate the impact of HR1 on the people, our friends and neighbors and our family members. Fund a state premium assistance program that can keep people covered. Fund equivalent coverage to citizens for legal immigrants. I'm not saying better, just equivalent. And fund navigators and community groups like Westchester Disabled on the Move to help people navigate through these cuts. At the federal, with our members of Congress, including Congressmember Lawler, let's get them to make it right. Delay these cuts. Extend Obamacare. Like, let's talk to other people, and let's negotiate a deal to make sure that we don't lose those enhanced subsidies for people to buy coverage in exchange. And those of you who are like activists, I have like a little bit.ly for you. You can just go there, and it links you right there, and you can call if you want to learn more about cuts in our neighborhood. That's the bottom bit.ly, and that's me. I'm done, and I'm really, really delighted to introduce Sonia Shaker, who is Deputy Director of New York State. Thank you, Sonia. Oop, I don't want to kill myself. I knew I was going to fall down somewhere.
Was this your phone? First of all, thanks for everyone coming out on a Monday night. This is an amazing turnout. Oh, sorry, I will not use this. Hi. Thanks so much for having me. This is an amazing turnout. I'm also a Rivertowns resident, and this is an incredible library, and I'm very envious of it. So really nice to be here today. And I will try to go through this kind of quickly so we can get to questions. So we'll get started. So just to give you a little bit of background on New York State of Health, we are the state's official health plan marketplace that was established under the Affordable Care Act in 2013. And New York State of Health is really the one-stop shop for health insurance in New York. I'm very biased, but I think we have the best marketplace in the country.
True.
We are truly a one-stop shop. A lot of other states, you kind of have to be passed between agencies, Medicaid and Marketplace. But in New York, we truly have no wrong door, and that's New York State of Health. And our enrollment is a testament to that, the ease with which we strive to provide really great customer service. Today, more than 1 in 3 New Yorkers actually get their health insurance through the New York State of Health. That's both in public programs like Medicaid and Essential Plan and Child Health Plus, but also for private health insurance coverage, qualified health plans, both with and without financial assistance. And one of the programs in particular, the Essential Plan that I'll talk about a little bit today, I think has been a key driver of driving down our uninsured rate in New York. And now it's below 5%. That's something we're very proud of. It's been cut in half since the marketplace opened. And among large states, we have the lowest uninsured rate in the country.
Yay!
So just to give you a quick overview, so one of the programs you can enroll in New York State of Health, there is Medicaid, and this is for low-income residents, including pregnant individuals and infants, children, parent and caretaker relatives, and adults who are 19 to 64 and not eligible for Medicare. We also have coverage for children. New York also has one of the lowest children's uninsured rates in the country. So under 19 years of age, New York State residents not eligible for Medicaid, and children are eligible for coverage in New York regardless of their immigration status. And then we have Essential Plan, which is a relatively new program I'll talk a little bit more about, which is for adults who are 19 to 64, who are lawfully present in New York and not eligible for other programs like Medicaid or Child Health Plus, and not eligible for affordable employer-sponsored coverage. And lastly, we have qualified health plans. So those are the private health insurance plans for New York State residents lawfully present in the country and who are not eligible for other affordable coverage types. So that's sort of where we are today. Sorry, I'll stand on this side. I'm not as tall as
There's that other microphone.
Is it? This one, sorry. I feel like I'm hiding behind here. So that's sort of where we are today, and here's a little bit of an overview of what has happened this year, which covers a lot of what Elizabeth already talked about in HR 1, but there were a couple other federal changes that also impacted coverage on the marketplace and eligibility. So the three major changes relate to the Essential Plan, which is kind of one of our groundbreaking waivers in New York that today provides coverage to over 1.7 million individuals. Unfortunately, due to changes in HR 1, we had to terminate this waiver, sadly, and I'll talk a little bit more about that. Then, what you've been reading about in the news, these enhanced premium tax credits, which were originally started under the American Rescue Plan during the pandemic and then extended in the Inflation Reduction Act through this year. Though that's sort of the subject of the government shutdown discussion right now. Those are set to expire at the end of this year. And lastly, there are the marketplace program integrity rules that came out earlier this year from the federal government, which took away eligibility from the DACA recipients, as Elizabeth noted earlier. Also just added some administrative burdens that make it a little bit more difficult for people to sign up for coverage. So all of these together are going to result in significant coverage shifts, as everyone has pointed out, especially in every year it sort of increases, and I think we'll really reach a steady state in 2027. But despite that, we are committed, as everyone has said, we're going to work together and try to mitigate these impacts, both the funding impacts and the coverage loss impacts, as much as possible. So starting with the 1332 state innovation waiver, so New York has operated the Essential Plan since April 2015. It was an option around in the Affordable Care Act for states, and it essentially allows adults who are not eligible for Medicaid, but still relatively low income, up to 200% of poverty, which is about $31,000 a year for an individual, to enroll in New York. Its coverage is pretty similar to Medicaid, and it's been enormously successful. And because of its success, we decided to apply for the state innovation waiver in order to lift the income eligibility for the Essential Plan up to $39,000 a year. That's 250% of poverty. And we think that it has been enormously successful. The expansion and the waiver was approved last year, so we started last April. And since then, almost 500,000 New Yorkers have gained coverage through this coverage expansion. And so with that, they're getting $0 premium coverage. And we think we're saving them about $6,000 a year compared to what they would have paid in qualified health plans. But HR 1 made devastating funding cuts to the Essential Plan. So essentially by taking away premium tax credit eligibility for lawfully present immigrants, which is the funding source for the Essential Plan program, HR 1 cut about more than 50% of the funding for the program. So that's about $7.5 billion a year, and that will grow every year. So what that means is, in order to preserve coverage for as many people as possible, we actually had to shift back to the old eligibility levels, the lower eligibility levels, to $31,000 a year. And given how quickly these changes are coming up, the first change starts this January, the biggest funding cut. We have to disenroll those 500,000 people that gained coverage next summer. So that's sort of the unintended, well, it seems like the intended consequence of this all. And as Elizabeth pointed out, these are going to result in huge uncompensated care costs for hospitals and economic ripple effects across New York. And the second change, as I pointed out, was the enhanced premium tax credits. So currently, more than 140,000 New Yorkers benefit from these tax credits. And the expiration of them, based on actual data we have of people's incomes in New York, will be a 40% increase in monthly premiums. So that's about $114 a month for an individual and about $240 a month for a couple. It's a little bit lower in this area, I think, but it's still significant, about 33% in Congressional District 17. So unfortunately, because of the timing of what's going on, we have been sounding the alarm bells on this expiration since January. We have shared all this information with our members of Congress, but it's now almost November 1st, which is the beginning of open enrollment. And so we've had to start sending consumers their notices on what their premiums and their tax credit eligibilities are going to be. So consumers are already finding out what's happening, and I think many healthy and younger consumers, which help keep all of our health insurance premiums lower, are going to make the difficult decision to stop, to disenroll from their health insurance plan, which, you know, I think, as we've all pointed out here, is bad for everyone when we pull out the younger and healthy people. So the expiration will be devastating. And the last piece, I'll quickly go over again the Marketplace Program Integrity Rule. It just sets higher standards for various verification requirements under the Affordable Care Act. It redefines who is lawfully present. So previously we had decided that DACA recipients were lawfully present for the purposes of enrolling in health insurance. They have revoked that definition. They've shortened the open enrollment period. So there's just a lot of new administrative burdens that they're adding to the already quite complex and rigorous process for enrolling folks in coverage. So we know that this is a really complex and upsetting time for many people finding out about these big health insurance changes. So, you know, what we feel like we can do is keep consumers informed. And so we've set up various resources for our consumers to stay informed about what's happening, what's changing, when things are changing. And we're also being very proactive in both training our local assistants, our navigators, on how exactly to help consumers through this sort of complicated time. And we're also very proactive about communicating with our members. We text message, WhatsApp message, email, not too much, just enough so people actually pay attention to what we're sending out. But that's what we're doing right now. But I think all of us are still sort of navigating through this challenging time to figure out how best to move forward. So I think that's all I have.
Thank you so much to both of our amazing speakers. The slides will be available outside. We have amazing vendors. We're going to be open until 8 o'clock. So please meet with our vendors, check with our vendors, and just want to assure you that Dana and I will be working on this in the budget come January when we go back to Albany. So this is a fluid situation. So we can't say right now what we will be able to do in next year's budget. We cannot backfill all of this, but we will endeavor, working with the governor and the health department and our stakeholders, to keep coverage for as many folks as we can. So thank you to Dana for arranging all of this, and for both of our teams for all the hard work. and for all of you for being here. Thank you so much.